Okay, so now we're going to do the second part of our assessment where we're going to do the neck, the upper extremities. We're going to do the posterior chest. Okay, so first thing we're going to do is assess the skin of the neck. So Mr. House, I'm going to just remove your gown for a minute so I can assess, visually look at your neck here. And I see that he has a tracheostomy, so I would document that, document when it was changed or if I need to change it, document any drainage around that. I would look at the skin, make sure it's nice and what color? Pink. And is it warm to the touch? Yes. Is there any bruises or any open marks or anything like that, or redness? I would note that as well too. Now we have two pulses. We have a pulse on the right side and on the left side in the neck. What's the name of that pulse? Carotid. The carotid pulse, right? Now, every other pulse in your body, you're going to assess at the same time, except for this one. You're going to do one at a time because we don't want to kill our patient, right? So the carotid pulse takes blood oxygen to where? What part of the body? To the brain, right? So if we occlude both of them, guess what? Our patient is not going to be in such a good position. So what we're going to do is palpate that carotid pulse. And you might say, what are we palpating for? Well, we are palpating for the rhythm. We want to make sure it's nice and strong and it's even bilaterally, okay? And then we want to count the pulse, right? We want to count the pulse for 30 seconds multiplied by 2, right? What's the normal pulse rate? 60 to 100. What you said. So we do it there. We remember what we felt. We go over here, do the same thing, 30 seconds. All right. And if you have a hard time figuring out, well, what is it that I'm supposed to document? What is it that I'm supposed to assess? Go right in here underneath pulses. It tells you. You're going to be looking at the strength, the rhythm, the rate, and it tells you how to document that. Okay. So we're done with that. Now, but our patient has a tracheostomy, so we can't really, assess the thyroid here. But if the patient didn't, we would put our hand, like right here, and we would have the patient swallow, right? And when they swallow, it should be midline. The trachea should be midline, okay? All right, Mr. House, way to go. Let's go down to the chest. Ooh, be careful there, girl. I know. Look at this. All right, so first thing we're going to do is we're going to assess the skin. And the color again is pink. And it's warm to touch, right? There's no redness, no bruises, no open wounds that I can see. All right, any numbness or tingling or pain in this area? You're like, okay. All right, so the next thing we're going to do is listen to the lungs, and then we're going to listen to the apical pulse, okay? All right, so you have to do this in a systematic format. So before I do this, you're going to listen on this side. This is how I do it, okay? So you listen on this side, here, 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 boom, apical pulse. Now, if you want to start on this side, that's your business. You can do that if you want to. Only thing that I say is you have to stay in a systematic format and you have to stay consistent with head to toe. Always continue to do it the same way so you don't forget a step. So why we want to do a systematic format is if you listen here, you want to listen here. And the reason why, because you want to compare the two, okay? So you listen here, then here, don't go here. So here, here, boom, here, compare. Then on the side, lateral, and then the other lateral, and I like to end on this side because I know I'm going to do my apical pulse afterwards. That's the reason why I do it that way. If you want to start this way, that's fine, but I always start on the right side, okay? So I'm going to do it. So when you're listening, put your stethoscope, always warm it up, put it on here and say, take a deep breath in and out. Very good. Take a deep breath in If you don't say out, your patient is very obedient. They'll just hold their breath. You got to say out. Ooh, Mr. House, good job. Deep breath in and out. In and out. Very good. Lateral, in and out. In and out. Good job. And then right over here is the apical pulse. And how long do I listen to the apical pulse for?
1 minute.
1 full minute, 60 seconds, right? And the heart rate is 60 to 100 for the apical pulse. Now, I'm going to teach you how to find the apical pulse. What are the landmarks? First, you find the clavicle bone, and then you find the mid-clavicular, which is just the middle of the clavicle, okay? And then you go down 5 intercostal spaces. Now, the intercostal spaces are the dense parts in between the ribs. So 5 intercostal spaces, and boom, right there, like 2 finger breaths right there, right below that left nipple, you will find that apical pulse, okay? Next, we're going to assess the arms. So we're going to just pull this. Ooh. All right. But since my patient here does not has an amputee, what happened, Mr. House? I don't want to know. Okay, that's fine. All right, so we're just going to assess the one arm here. But if we had both, we would do it bilaterally because we normally have 2. So therefore, we're going to look at the skin, make sure it's nice and warm to the touch. Make sure it's nice and pink, right? We're going to assess for any bruises or anything of that nature, any open wounds. And then I'm going to assess his pulses. I really need to get on that side. So I'm just going to skedaddle. Okay, come on with me. Of course, I will have that railing up because I'm a good nurse, all right? So you can comment below all the things that like, ooh, that was a safety concern. Yeah, okay, that's what we're going to do. All right, so the first thing we're going to do is assess the first pulse that's in his arm here. Which one is this one, right in the crease of the elbow in the front? Brachial pulse, right? So we're going to assess that, and if we had 2, we would do them bilaterally, correct? And then which pulse is this on the thumb? Radial pulse, very good. And which pulse is it here on the pinky? What's the name of that one? Ulna. Yes, fantastic. All right. So then we're going to do a capillary refill on each finger. So we press, and it turns white, and then it turns back pink in less than how many seconds? 3 seconds. So capillary refill should come back in 3 seconds. Okay, so he's good. Then we're going to have him squeeze my hand, squeeze it real tight. Ooh, ooh, you're strong, strong. Okay, pull me towards you. I was trying to get a kiss, right? And then push me away. Very good, very good. So that is the upper extremities and the chest anterior portion. And next we'll talk about the lower extremities.